Thanks for having me on the show today. According to Boston University, chronic traumatic encephalopathy, or CTE, is a progressive brain disorder that is found in athletes and others with a history of repetitive brain trauma, including symptomatic concussions as well as asymptomatic subconcussive hits to the head. The trauma triggers progressive degeneration of the brain tissue, causing the buildup of an abnormal protein called tau. What happens is when the brain is impacted, or when the head is impacted, the brain moves inside of the skull and causes tears in the brain tissue. These tau proteins will fill the gaps that these tears made and basically form tangles around the blood vessels in that area, which will interrupt their normal functioning and eventually kill the nerve cells themselves. The changes in the brain may take months, years, even decades to begin after the last occurrence of brain trauma or the end of active athletic involvement. The effects of this brain degeneration can vary depending on the severity of the case. Patients with less advanced forms of the disease can suffer from mood disorders such as depression and bouts of rage. More severe cases can experience confusion, memory loss, and advanced dementia. Basically, CTE can affect any cognitive function, such as areas involved with executive function, attention, memory, and emotional regulation. Many studies of the brain of deceased retired NFL players have been conducted in the past few years. One of the most recent studies conducted at the Department of Veterans Affairs Brain Repository, which is the nation's largest brain bank, involved the brains of 128 football players who before their deaths were involved with the sport either professionally, in college, or in high school. And of these 128 players, 101 players, which is about 80%, were positive for CTE, which included 79 brains of NFL players, 76 of which were positive for CTE. These numbers are staggering, but this doesn't even take into account for the amount of players that have the disease that are still living. As of now, there's no test that can identify CTE in a living person. The only test they have now, which was developed by UCLA, can identify the tau proteins in the brain tissue. That's all they have at this point, but researchers believe a scan for CTE is only a few years away from being developed. As far as we know, CTE can begin to develop as soon as the athlete starts to take regular repetitive hits to the head. One of the youngest cases to this point is former Penn State football player Owen Thomas. Thomas hung himself in his off-campus apartment in what his family and friends described as a sudden and uncharacteristic emotional collapse. When they found him, he had his phone and his wallet and his personal belongings still in his pockets that you would have on a normal day. So they believe it was just a spur-of-the-moment kind of thing, like he just snapped. He was 21. The weird thing about Thomas was that he was never diagnosed with a concussion or even complained of a headache while he was playing football. However, his parents said he was the kind of person that would ignore symptoms to stay in the field. Thomas, right now, is the youngest and first amateur football player to be found with a clear case of CTE, bringing into question the safety of football at all levels. Personally, I believe parents need to be more informed of the dangers of the sport of football. It's not a matter of not allowing children to play football. It's the fact that people need to be more informed about concussions and brain injury and do everything they can to limit the damage. I don't believe that I would allow my children to play football, but that's just my personal opinion, and I believe this goes along with what others are thinking, as we've seen the President, Barack Obama, and NBA player LeBron James publicly come out and say that they will never allow their sons to play football.